We're doing what Albertans voted for. They want stability. They want to make sure that they have a government that's investing in healthcare and education. And of course, we need to bend the cost curve, but we're not going to do that at the impact of confidence in the healthcare system and frontline jobs. At the same time, people are losing jobs in the private sector. Albertans don't want that to happen in the public sector as well. There's some big drivers. One of the areas that I really need some help with is around hospital financing, and that's one of the reasons why we just appointed the new board for Alberta Health Services. I'm really confident in their ability to help us find some of those efficiencies and make sure that Albertans continue to have the right care in the right place at the right time, but for the right investment, because we really have been seeing a greater cost curve in Alberta than in any other province. So we need to make sure that that gets addressed in the next few months. When you look at the three big drivers, physician compensation, drugs, and hospitals are some of the big areas where the biggest increases have been in past years. So we'll need to be working with our physicians to make sure we bend that part of the equation as well. It's something that keeps me up at night.
I was disappointed to see that spending has gone up. I'm disappointed to see that they've added 700 full-time positions to Alberta Health Services. This government has shown that they're presuming that every dollar that was being spent with value. Albertans have clearly told me that we need to look at reducing the number of high-level bureaucrats in Alberta Health Services. Human resources are very, very strained. Employee dissatisfaction is very, very high because there's too many levels of bureaucracy to work through to get answers and to make the patient the center of our healthcare system. So adding bureaucracy and not facing the fact that there's too much now just prolongs the problem of waiting times being too long, and targets not being met, whether it comes to access to cancer treatment or cataracts or those kind of things. The talk, of course, was to keep healthcare spending increasing at, I think it was 4%, and a reduction down the road to a 2% increase at a time that so many Albertans, so many of our good companies are facing hardship. To see this increase continue is not a surprise from this government, but it's disheartening. Again, there's so many areas that we could look at for some savings. Mental health, let's back up. Mental health and preventative health and community health are areas that Albertans are telling me are needed, and other jurisdictions have shown there's huge savings if we can focus hard-earned tax dollars on mental health, community health, and preventative health. This budget was silent on those.
There's a great deal of new spending going on and increases in each and every year, and by some magic they're going to come back to a balanced budget despite what are significant increases in spending and not corresponding increases in revenue. It's a budget that really doesn't add up. Well, again, health spending is close to 50% of the provincial budget, and that is true of the provincial budgets right across our country. And there are a number of things that are cost drivers within healthcare, and one of them is getting more serious about prevention. And at least so far, I've not seen any new or commitment to increase preventive medicine, it's been shown that there are a number of the cost drivers that they have to grapple with, and there's some nice talk about that we're going to do that. It turns a lot more difficult when it comes down to the actual nitty-gritty.